Hello everyone, welcome back to 3 News Now. I'm Stephanie Haney. It's Wednesday, July 15th. We have your top headlines for you from WKYC.com and our WKYC app. I hope everyone's having a nice afternoon, enjoying nice weather out wherever you are if you get to be outside. We do have those most up-to-date numbers in from the Ohio Department of Health related to COVID-19 here in Ohio, so we'll start with those. Just a reminder before we get into those numbers though, because sometimes we can lose sight of this. Why are we tracking these numbers every day? The reason that we've been tracking these numbers every day is because what we've been looking for is a 14-day downward trend. That's what we want to see in these numbers in terms of new cases, in terms of hospitalizations, in terms of ICU admissions and deaths reported. Unfortunately, we are not seeing that, but that's what the experts have said we wanted to see before we can really start to think that we're moving in the right direction with how COVID-19 is being dealt with here in Ohio and across the U.S. Now, here's a summary of where we are today, and it is not great news today. We are actually up across the board. We are up in terms of new cases. We are almost at 70,000 total cases known here in Ohio now. Deaths are up, however, slightly, but they are up. Hospitalizations are also up, and a very high number, and ICU admissions in the past 24 hours are up. So let's break those numbers for you down right now. Today, we've seen 1,316 new cases of COVID-19 reported in the last 24 hours. So we had a couple days of that number dropping down just a bit, but that's over now because we are now up again from what we saw yesterday when we saw 1,142 new cases. So that brings the total number of cases that we've seen here in Ohio dating back to March 9th to now 69,311. Now, the Ohio Department of Health has recently started reporting on the number of presumed recovered cases. They do caution that this is not a definitive number, but it is presumed because once people leave the presence of their medical care professional, it's just the data is not necessarily there for them to know definitively who has recovered. But right now, the number of presumed recovered cases is 47,303. So that puts us at the same percentage we've been seeing all week long. 68% of the known COVID-19 cases are presumed to have been recovered. That means that at least 32% of all the cases of COVID-19 that we've seen here in Ohio dating back to March 9th, 32% of those cases are active right now. The most up-to-date information we have about our positivity rate, which is the rate of tests that come back positive with all of the testing that we're doing, is 6.2%. So that's down from what we've seen over the past couple of days, but it's still above the World Health Organization's recommended threshold of 5%. In the last 24 hours, we have seen 6 new reported COVID-19 deaths. That's up from yesterday when there were 5 new reported deaths, and the previous day there were 6 new reported deaths, and that's down from July 12th when we saw 22 new reported deaths. So that brings our total number of COVID-19 deaths here in Ohio to now 3,075. Now, the number of hospitalizations we've seen in the last 24 hours is up. It is 160 new hospitalizations that we've seen in the last 24 hours, up from yesterday when we saw 134 new hospitalizations. And on Monday, we saw 73 new hospitalizations. So quite the increase from the beginning of this week. That brings the total number of hospitalizations we've seen related to COVID-19 to now 9,209 here in the state of Ohio. Now, the number of patients who are currently in the hospital right now at this moment with COVID-19 is 1,027. So if you look at that as a percentage of all the people that have been hospitalized, 11.2% of people who have been hospitalized with COVID-19 are in the hospital right now. Of those people who are in the hospital right now, 316 of them are in the intensive care unit. So that means of all the people who are in the hospital right now, about 31% of them are needing treatment in the intensive care unit. We saw 36 new ICU admissions related to COVID-19 in the last 24 hours here in Ohio, bringing that total number of ICU admissions dating all the way back to March 9th to now 2,259 here in Ohio. Now let's take a look at the national and the global numbers. We get these from Johns Hopkins University. Today, the total number of known cases related to COVID-19 across the entire U.S. is almost 3.5 million. It is 3,454,190 to be exact. That's just over 67,000 new cases in the last 24 hours. The total number of deaths that we now have seen in the U.S. is 136,807. So across the entire U.S., that's a total of 823 new deaths reported in the last 24 hours. Now, if you take a look at the number of deaths, that total number just under 137,000, of the cases that we know about, which is just under 3.5 million, we have a death rate of about 4% here in the U.S. And we still hold fast at that 26% of the known global cases and 24% of the known global deaths. That's on par with what we've seen for quite some time in terms of percentages of the cases and deaths here in U.S. from what we know globally. Globally, there is now almost 13.4 million reported cases of COVID-19, with that exact number being 13,391,024. And the total number of deaths globally is just over 580,000, with that exact number being 580,286, making that death rate in terms of the number of deaths as compared to the number of known COVID-19 cases globally at 4.3%, which is down from yesterday when it was 4.4%. We have seen that ticking down ever so slightly over the past couple of days. Now, we do have some good news in terms of a vaccine. We did talk about that this morning, but there's some more information to share with that for you now. Moderna is seeking a total of 30,000 volunteers to go on to the final stage of testing a vaccine, and they do want some volunteers from Cleveland. They are seeking to test the results of what is called the mRNA 1273 vaccine. It's the mRNA 1273 vaccine. This is the first vaccine being developed in the U.S. to prevent COVID-19. And this study will determine whether the vaccine can prevent the virus for up to 2 years after the second dose is given. That's what they want to study here. Now, yesterday, researchers reported that the vaccine did boost immunity in the initial small sample size. There were 45 people studied, and these people had volunteered back in March, so they released that data yesterday. Dr. Anthony Fauci, who is our nation's top infectious leading disease expert, he said no matter how you slice this, this is good news that they received these initial results from the study and are now moving on to the second phase. So this is an experimental vaccine that's been developed by Fauci's colleagues at the National Institutes of Health, along with Moderna, Inc., who are now seeking the volunteers. The trial is set to begin on July 27th, and it will go through October 27th, so for the next couple of months here. It's 2 doses of a vaccine. You get the first dose, and then you get another dose 1 month later. And if you do want to volunteer, you have to be 18 years old to participate. Now, there's a long list of conditions and exclusions in order to participate in this trial, so you can check all of that out on WKYC.com and also on our WKYC app. A quick look at the websites for the companies that are doing this trial, which is Rapid Medical Research and Moderna Clinical Trials, says that there is compensation available for people who do participate, but couldn't immediately find out exactly how much compensation. So that's something that you'll find out as you proceed down the process if this is something that you are interested in doing. So if you do want to do that, you can contact Rapid Medical Research or Moderna Clinical Trials, and we have that information on WKYC.com and in our WKYC app. Now, here's something that's pretty cool. Not pretty cool in terms of the information that you're looking for, but pretty cool in the way that this has been put together. Georgia Tech has put together an interactive map where you can choose any county in the United States. You can pick the event size, the number of people that are expected to be in a particular place at a certain time, and that ranges anywhere from 10 people to 10,000 people. And that map will calculate the risk that one person there will have COVID-19. So this is a county-by-county risk calculator for encountering, that's a mouthful, a county-by-county risk calculator for encountering COVID-19 at any event in any county across the U.S. So I plugged in a couple for us here in Northeast Ohio. In Cuyahoga County, according to this map, if you're in a place where 10 people are there, there's a 20% chance that one person might have COVID-19. In Cuyahoga County, if you're in a place where there are 25 people there, there's a 42% chance that someone might have COVID-19. And if you're in a place in Cuyahoga County with 50 people present, there's a 66% chance that one person there might have COVID-19. I also ran one for Stark County, which is where my hometown of Canton is. If you're in Stark County, in a place where there are 50 people present, there's a 26% chance that someone there might have COVID-19. So that falls in line with some of the information we know here about our counties and our alert system that Governor Mike DeWine has recently put out. He put that out last week. So this is all based on data from the COVID Tracking Project at The Atlantic. And that pulls daily data on COVID-19 testing and patients from all 50 states. And it's also based on 2019 U.S. Census data to determine the population in those areas. It's called the Interactive COVID-19 Event Risk Assessment Planning Tool. That's the name of it. And this was developed by researchers at Georgia Tech's Institute of Technology, Biological Sciences, and the Applied Bioinformatics Laboratory, ABIL, ABLE for short. Check that out on WKYC.com. You can plug in lots of things there. You can see what an event of 10,000 people would look like here in Ohio, although I'm guessing in Cuyahoga County, if it's 66% at an event for 50 people, when you get up to 10,000, it's probably 100%. And I don't know where it hits that 100% between that 50 and that 10,000, but I would guess it's closer to the 50 than it is to the 10,000. Check that out. It's a pretty neat little tool. So, as you know, we've been gotten used to hearing Governor Mike DeWine speak at 2 p.m. on Tuesdays and Thursdays. Well, he didn't speak yesterday because he's speaking tonight. He'll be addressing the state at 5:30 p.m. tonight at 5:30. He did say yesterday that there was no emergency, but this will be a speech tonight, so there won't be any Q&A portion at the end for media, but he will be briefing people on Thursday as well, so we can expect a question and answer period then. Now, just to give you a little recap of where we stood as of last week, both Summit and Lorain County were upgraded to level 3 red alerts in our risk level alert system for COVID-19. That triggers the state issued mask mandate in those counties. Cuyahoga and Trumbull County were already at that level 3 red alert, meaning the masks had already been required. But Cuyahoga County was then designated as approaching level 4 purple, which is the highest alert under the COVID-19 alert system. That means at the level purple, 6 to 7 of those metrics that have been put in place by Governor Mike DeWine and our Department of Health officials have been met, and that indicates severe exposure and spread of the virus. We do know from the state that they pulled that data today, and we expect to see those county levels updated tomorrow, although it is possible he might say something tonight, but at the very least, we expect to see those county levels updated tomorrow on Thursday. Here's some non-COVID-19 related news for you. If you have an Apple device and if you've had it for a while, Apple might owe you $25. Or if you used to have an Apple device prior to the end of December 2017, they might owe you a little bit of money for slowing down your iPhone or for allegedly slowing down your iPhone, because Apple has agreed to pay certain iPhone users to settle claims that it purposely slowed down devices to preserve older batteries. This is because of a class action settlement. The lawsuit claimed that Apple slowed down some features on purpose on iPhones and other devices. Now, Apple says that that's not true, but they agreed to the settlement so that they could avoid going to court. Regardless, people with eligible devices are entitled to probably about $25 each. $25 is $25, and it doesn't take long to file a claim, but you do need to have some information. Now, Apple did agree to pay between $310 million and $500 million. So depending on how many people submit those claims, the money could be higher than 25 or lower than 25, but it is anticipated to be somewhere in that ballpark. Here is who this applies to. If you had an iPhone 6, 6 Plus, 6S, 6S Plus, or an SE device that you had before December 21st, 2017, and it was running on at least iOS 10.2.1. And U.S. owners of an iPhone 7 or a 7 Plus before December 21st, 2017 that ran on iOS 11.2 or any later upgrades. Here's what you need. You need the serial number of that device, which many people may not have, but there's good news. You can also have the Apple ID that was used on that device, and that's probably a lot easier for people to come by because odds are, if you had a certain iPhone in 2017, you may not have that iPhone anymore. So as long as you have the Apple ID, you can submit a claim for that. So that website is smartphoneperformancesettlement.com. You need to submit that claim before October 6th if you want to be included in the settlement. Here's some entertainment news for you. Kanye West has reportedly dropped out of the presidential race. This is according to DailyMail.com. They say that an election strategist who was hired by Kanye West says he's dropped out of the race, but that he actually was serious about running and hired 180 campaign staff. And he was trying to get on the ballot in Florida and South Carolina. Now, there were many states where Kanye did miss the deadline to file to get on the ballot already, but in Florida and some other states that had a July deadline, he had supposedly hired those staff in order to try and get on those ballots. But staffers claim, according to DailyMail.com, that he was out last week. Kanye West hasn't publicly commented on this, and he first announced again that he was hoping to run for president on the 4th of July this year. Now, he said it before, but he said it again on the 4th of July. One more reminder for you before we go. This year's VeloSano fundraiser has gone virtual. What that means is it's not just a bike ride this year, and the whole goal here is to raise money for cancer research at the Cleveland Clinic. WKYC is a media partner of the virtual VeloSano fundraiser this year, and you can get active in any way that you want. So if you want to participate, you can ride a bike, you can go for a walk, you can take a jog, you can go roller skating, whatever it is. You can register as an individual person, or you can register with a team and do some fundraising, or you can support Team WKYC. We have at least 23 people on the team who will be doing something active on Saturday. That includes me. I plan on biking at least 10 miles on Saturday. On Friday, our Mike Polk Jr. and Maureen Kyle will be hosting the virtual kickoff event. So that'll be live streamed at 6 p.m. on Friday. So if you want to get involved, you can head to our article about it on WKYC.com so you can register yourself, as I said, or you can support our team's fundraising efforts. That is linked in the WKYC.com article. I also have a fundraising page through Team WKYC. You can find that on my Twitter and my Instagram pages, and also on my Facebook page. My username on Twitter and Instagram is _Stephanie Haney, so you can find it linked in my bio and in recent posts that I posted. That's it for your 3 News Now afternoon update. I will see you at 5 p.m. on What's New with your trending stories, along with Jay Crawford and Betsy Kling and the whole What's New team. And I'll see you back here on Friday. I'll be out tomorrow, but someone else will be with you on Thursday to give you your 3 News Now updates. I'll be back on Friday. Everyone, enjoy the rest of your afternoon. Have a great day. I'll see you at 5 o'clock on What's New, which you can stream for free in the WKYC app. I'm Stephanie Haney.